Estrogen has very important roles in the human body, especially for women. You know, the term estrogen really is a plural term. There's many different types of estrogen in the human body. The first type of estrogen is known as estrone, or E1, and it's the main type of estrogen made when a woman is in menopause or after menopause. The second one is known as estradiol, or E2. This is the most powerful form of estrogen and the one that's most dominant in premenopausal women. The third is estriol, known as E3, and it's the weakest form of estrogen, although it plays a very important balancing role in a woman's body. Researchers have shown that estrogen has about 400 different functions in the human body, obviously a very important hormone for women. This includes increasing metabolic rate, improving insulin sensitivity, improves sleep, stimulates an enzyme in the brain that produces acetylcholine, which is needed for memory. Estrogen protects against muscle damage. It maintains muscle mass. Estrogen's been shown to reduce cataract and glaucoma risk. It increases blood flow. It's been shown to decrease plaque accumulation in arteries. It maintains collagen in skin and increases water content of skin for softness and thickness. Estrogen reduces wrinkles. It also has been shown to decrease blood pressure, as well as decreasing LDL, or the bad cholesterol, as well as LDL oxidation. Estrogen acts as a powerful antioxidant in the body. It regulates carbohydrate and fat metabolism. It's involved in normal sexual and reproductive function. Estrogen is important for regulating bone mass and strength. It's been shown to decrease the risk of colon cancer, as well as prevent tooth loss. It relieves hot flashes in menopausal women. It treats vaginal atrophy. It also treats vaginal dryness and pain with sexual intercourse related to breakdown of the vaginal tissues. It also treats urinary symptoms such as urgency, pain, and recurrent urinary tract infections. It's been shown to reduce joint pain, and it's used in the formation of neurotransmitters in the brain, such as serotonin, to lessen depression, irritability, anxiety, and sensitivity to pain. Bioidentical or natural estrogen has been shown to be quite safe. A review of studies comparing bioidentical hormones, including estradiol, estriol, and progesterone, to synthetic hormones, found that bioidentical hormones are associated with lower risks, including the risk of breast cancer and cardiovascular disease, and more efficacious than their synthetic counterparts. For the best balance, when we give estrogen replacement to women, we always combine it with natural progesterone. The two work together, and progesterone has a balancing effect, making sure that estrogen doesn't have an overstimulatory effect on the tissues.